Hello, Miss Payne. How are you doing today?
Pretty good. How are you?
Good, thank you. My name is Kristen. I'm going to be the student physical therapist working with you today. Is that all right?
Yeah.
Okay, so how are you doing?
I've been better.
Okay.
But, yeah.
So what brings you in today?
I've just been having like chronic low back pain. Like it's just an achy low back pain, and I mean it's just been there for like 2 months now.
Okay, so aching,
Yeah.
about 2 months. Now, is it just localized in that one area of your back? Or would you say?
No, sometimes it like shoots down my right leg.
Okay, and about how far down that leg does it go about?
Like halfway down my
To
hitch.
mid-thigh, okay,
Yeah.
okay.
Yeah, but it's like a sharp shooting like pain.
Okay, so the achiness of it, is that a constant ache or when certain things?
It's constant, but like when I move a lot or like sit for a long time, it gets worse.
Okay, and then the shooting pain,
Yeah.
does it have any aggravating factors? Does it flare up at certain times?
I would like the same thing, like just moving, or like if I'm working out, like that's when I've noticed the shooting pain getting
Okay.
worse. So,
Is there any certain things within you working out you've realized that may make it a little mad?
like if I do like deadlifts or anything
Okay.
like that, like anything like
So
bending over.
Moving, you're
Yeah.
hinging kind of at the hips almost.
Yeah.
Okay, and how would you rate that on a scale of 0 to 10? 0 being no pain, 10 being the worst pain you can imagine.
I mean, on my worst days, I would say it's like a 5 or 6.
Okay,
But I mean, right now it's
Right
like
now.
it's like a 2.
2, so tolerable
Yeah.
essentially. Okay, and yeah, and have you done any imaging on that?
No, I haven't gotten any imaging. The only thing I've done really is, I mean, I've just taken like ibuprofen, help with
So
the
just
pain.
over the counter. Okay.
And then I've used like the TENS unit or like the
Yes.
stimulation. And that helps a little bit, but not really.
Okay, and do you have one of those at home, I'm assuming?
Yeah.
Okay, so that's kind of, so you would feel the TENS just kind of more of a temporary fix, essentially?
Yeah, it kind of just like it helps for like an hour or so, and then it comes back.
Okay, and you haven't had any surgeries on your back or anything, correct?
Mm-mm.
Okay, and you've never had this happen to you before?
No, I mean, yeah, no, it started like 2 months ago, and
Mhm.
it's just kind of been aching ever since.
And what caused this injury?
I don't know exactly, but I'm pretty sure it was when I was loading a like really heavy, like 50-pound bag of dog food in my car,
Okay.
and I kind of just felt it starting then, and then it's just
Kind of,
been there.
so that was the starting point and then just kind of
Yeah.
progressed essentially as you kept doing stuff. Okay, so it wasn't like a one and done time and
No.
okay, you felt it kind of progress.
Yeah.
Okay, and you said just bending kind of aggravates it, so
Yeah.
are you trying to avoid that or obviously is it?
Yeah, a little bit. I mean, also like coughing, sneezing, like
Okay.
kind of anything like just movement wise kind of bothers it.
Does it bother you when you go to sleep or anything like that? Does it keep you up?
A little bit, yeah. I mean, especially if I like change positions, I definitely feel it and it like wakes me up. But I'm able to go back to sleep just fine. So
What is the most comfortable position for you to be in with little pain? Laying down, sitting?
yeah, probably laying down.
Laying
like,
down
on my back.
straight on your back.
Yeah.
Okay, that's good to know. And okay, so I've seen coughing, sneezing, shower. So okay, right leg. Okay, perfect. And have you received any other treatment for this issue?
No, just the TENS unit.
Just the TENS unit at
Yeah.
home. Is that something your doctor recommended?
No, I just kind of read about it. And
Okay.
thought it might help. I
And
mean,
how-
I've used it before with like other little injuries and it worked, but this is just not going away.
Okay. And now I do see that for some of your symptoms, you also checked nausea and vomiting.
Yeah, I don't really know what the deal with that
Okay.
is. It just kind of it started like maybe like a week ago. Maybe I'm just like getting sick.
Okay. And are you feeling it like at certain times of the day or after at certain activities?
No, it's just happened a few times in the
Okay.
past week.
I just wanted to check on it.
Yeah.
You know, because I noticed you labeled it. Just wanted to
Yeah.
make sure everything was okay there. And okay, yeah. And have you had any other like major life changes in the past couple of months that could maybe also be affecting back pain?
No, I don't think so. I mean, I've been at the same job
Mhm.
for a while, so.
Okay, and I see, yes, you work for the IRS. Kind of go through
Yeah.
your day with me. What does that entail?
It's a lot of office work, so
Okay.
I'm just kind of sitting at a desk all day, taking phone calls, doing
Okay.
computer work, so that kind of makes it flare up a
Sitting
lot.
down
It's
for a long
just-
period of time,
Yeah,
kind of
I mean, it's
aggravates it.
hours, so,
Mm-hmm.
yeah.
Okay, yeah. And now, okay, I see you are married and live with your husband, and do y'all live in a 1-story or a 2-story?
A 1-story.
A 1-story, okay, so
Yeah.
no stairs to aggravate that, that's good.
Mhm.
And now, do you use tobacco products or drink?
Mm-mm. I mean, I'll have like a couple drinks on the weekend. but-
Socially?
Yeah.
Okay, yeah, alright. Okay, yeah, so this definitely is something, okay. And I see medications, you are just taking 2 medications and neither are pertaining to your back except for those over the counter, you said.
Mhm.
So ultimately, what is your goal? What do you want out of physical therapy?
I mean, before my back started hurting, I was doing like Pilates classes and kind of like doing some weightlifting. But ever since it's happened, that's been super painful. So probably just getting back to those with no pain and being able to sit at my desk without pain.
Yeah, that's a big one. If it's,
Mhm.
that's part of your everyday life, absolutely. Okay, well, perfect. So what I want to do next is schedule you for a physical examination just to get some range of motion testing as well as strength testing. Does that sound okay with you?
Mhm.
Okay, so we can head up to the front and see what availability we have.
Awesome.
Thank you. It was
so
very
much.
nice meeting you.
Yeah, you too.